So, welcome to South Asian Public Health Association Spotlight Series, the platform where we spotlight the remarkable journeys and career trajectories of trailblazers in public health, with a special emphasis on South Asian community. We're your host. I'm Rubana. I am the co-chair of Advocacy Committee for the South Asian Public Health Association, or SAPHA.
I'm Thoyne, the Communications Committee member for SAPHA. SAPHA is an organization dedicated to advancing the health and well-being of South Asians in the U.S. and the communities in which they live, and has been instrumental in fostering collaboration, advocacy, and research to address health disparities and promote equitable health outcomes. Today marks a special occasion as we continue a series of interviews commemorating the 25th anniversary of SAPHA. As your host, we are thrilled to delve into captivating conversations with influential figures in public health. Stay tuned for inspiring stories, insightful discussions, and a closer look at the impactful work of SAPHA over the past 25 years. Learn more about us and explore the wealth of resources we offer at www.sapha.org.
For our eighth episode today, we're honored to have Dr. Shipra Singh with us, a distinguished professor in public health and the founder and director of Health Equity Research Center at the University of Toledo. Dr. Singh has a wealth of experience in health equity, social determinants of health, and the intersection of medicine and public health. She also served as a chair for SAPHA's communication and research committees from 2015 to 2020, then as SAPHA's vice president from 2020 to 2021. Dr. Singh, welcome to the SAPHA Spotlight Series. We're so excited to have you on with us today.
Thank you so much.
Yeah, thank you so much for being here today. To start us off, can you share a brief overview of your journey in the field of public health, and how did your career path lead you to where you are today?
So first of all, thank you so much for inviting me. I'm super happy to be here. I'm happy to be speaking to everybody who's listening today. So I started my career as a medical student in India. I was 18 years old when I went to med school, and my most favorite rotation and elective was something called PSM, which is preventive and social medicine. So as I graduated through med school, I was quite comfortable and confident with this idea that I needed a social medicine kind of a perspective in my future practice. However, I ended up being married and coming to the United States. And so as I was prepping and working in the hospital system here, I knew that I wanted to expand my vision and my practice in the future. I wasn't just satisfied with being a clinician. I was doing a residency in psychiatry at that time and an externship program. And so I applied to the University of Michigan and got into the M.P.H. Ph.D. track for health behavior, health education, master's in public health. And this is at the turn of the century, like 1999, 2000, when I got admitted. And the first class I walked into with great hesitation, thinking, have I done the right thing leaving behind my, my career track in medicine and moving into public health, was meeting somebody called Dr. Sherman James. He was teaching a class on social epidemiology. He is one of those brilliant African-American professors who opened my eyes to a way of thinking that I had never thought about, being in the US for 2-3 years and practicing, and working in the hospital system. And the recognition that the experience of America is very different for different people. And when you come from a privileged background of education and a privileged background in the US and you join the hospital system, you don't recognize the challenges that our community faces. And not just our community, multiple communities in the US. And so learning that through that process of social epidemiology opened my eyes and ascertained that this is what I want to do for the rest of my life. So that is how I've just continued for the last, I'm aging myself, but almost 25 years now.
Dr. Singh, thank you very much for that response. It really shows us how a journey isn't always a staircase, but it's filled with spirals. Your journey is truly inspiring. Now, speaking of impactful work, you've also been deeply involved with SAPHA. Could you tell us how you became involved and what sparked your interest in South Asian public health?
Right. So when I joined the public health program, the PhD track and the MPH track, I was looking for similar research, information, knowledge about health facts for South Asians. And the only thing that existed, and there was Professor Gee at University of Michigan, he referred me to the brown paper bag, I believe it was in 2002. And I couldn't find any hardcore health facts for South Asians specifically across the nation. There were regional small information, but we didn't know anything at all. And so that's the first time I heard the phrase SAPHA. And so I wrote to SAPHA an email and saying, this is who I am, and I'm brand new in this country, and I really want to work in South Asian health. And and being a student and everything, I lost, the world was not socially connected the way it is today. So the responses were not that fast. So I lost track with SAPHA for a few years. And then when I finally settled into my program in my first job, that's when I said, okay, I need to reconnect with SAPHA because I've been thinking about it for a few years. And so I wrote back and got a response instantly because the world had changed by then in 2010, 2015. Between that time, and I watched and I looked at SAPHA for a year, and then stepped up and came to them in 2015 and said, I would love to join the organization. And so I went through the rounds of joining, and then being interviewed for the board of directors, and then being assigned a space in SAPHA to conduct, and join the amazing group that SAPHA was at that time. Yeah.
Thank you so much for sharing that. You really wanted to stay connected and kind of give back to the organization as well. So I know you talked a little bit about what drew to South Asian public health, and it's clear that SAPHA has been a significant part of your journey. But building on that, I would love to hear more about how your time with SAPHA has influenced your career and how it has contributed to your public growth in the field of public health.
Right. So my PhD when I graduated was in South Asian health. And there was a data set collected for the first time across the nation called NLAS, National Latino Asian American Study. And it had national data on South Asians. And so it was my first exposure that we could contribute significantly to South Asian health. And then when I actively joined SAPHA, I was assigned to be the communications chair. So the first thing I started doing, in those days, the world was about blogs. And we used to write blogs and newsletters. So the first thing I implemented, as a SAPHA team member was, how about we write blogs about what we think about research? What is the importance of data and data disaggregation? So one of my first blogs I wrote about was research methodology and why it's important to know and to do it correctly for unique, special, small, different population groups, and how it can have an impact on in the future, in terms of funding, in terms of knowledge, in terms of information. And so that's how I started with SAPHA. Then I got actively involved with Chai and Chat. I think it was 2016 when we had Dr. Murthy come in to SAPHA. It was one of the biggest events that we hosted. And I was one of the organization team members because I was in communications. I was the communications chair. So learning how to, book the venue, invite them, speak to his team. And we had an amazing team as board of directors at SAPHA that made it possible for us to connect with him. And so as I built more and more in communication, at my core, I'm a researcher. I'm a clinical researcher right now. So I really wanted to shift my gears and go into research. And so when I had the opportunity of people who were better than me with communications and skills that is required in being, tech savvy, took over, and I moved into the research aspect of SAPHA. And that's where we started working through and thinking through how do we. So it's like a relationship that as my knowledge and strength grew in my own world of my workspace, it informed what I did for SAPHA. So during the last few years, working with a team of board members and SAPHA friends, I was involved in submitting posters to APHA, publishing 2 manuscripts, with APHA, being involved with CDC Health Talk. And in those times, CDC would request organizations to support their understanding of the information that they were posting about travel needs and requirements when you go to a certain part of the country. So they had published information about the travel health information required when you go to India, and they translated into multiple languages. But it had to be, checked and reviewed and assessed. So we were a part of the team that got it done, in Gujarati and Punjabi and multiple languages to make sure that the information that is being written in these regional languages is accurate and appropriate. So, it built my own strength as a new professor, as an assistant professor, as to how to conduct community research, intervention research, how to communicate to organizations. It built my confidence to, build a trajectory of research and funding in my own world. But it also created an opportunity for me to publish. And as you know, I live in Michigan and I work in Ohio at University of Toledo. So it gave me an opportunity to connect and collaborate with people across the nation. If nothing else, I am so grateful to the opportunity of meeting researchers, students, South Asian professionals who are interested in this field, organizations across different nations, across the nation, who are working very strongly with SAPHA. And in our newsletters that I had started, being actively engaged in building newsletters in 2016, we used to do it 3 times a year at that time. We would spotlight organizations from different part of the nation. So getting to know the amount of work that is being done across the nation, because sometimes in the Midwest, you get siloed, in smaller cities. If you're not a regional center like New York or California or Chicago or Texas, you get isolated in your professional life and you don't meet like-minded people who are committed to South Asian health. So this was my lifeline of being connected to something that I was passionate about. I did my PhD with South Asian health. So I don't know if I'm answering your question completely, but that is how synced SAPHA has been with my research experience and my research world in my real life, and has built my interest in serving, vulnerable population groups, underserved groups, understanding challenges that people face, when they're thinking about health outcomes or utilization of the healthcare system. So yeah, that's my connection with SAPHA.
As I say, thank you very much for sharing that. And as the current communications co-chair, I hope you are happy with the direction of the newsletters right now. And I hope we can improve in the future and build off on the work that you laid the groundwork for.
I'm really, really excited when I get an email from you. I love reading everything. New faces and new people, so many students, so many younger folks, who are joining and managing different parts. And we've grown in terms of our committees and the scope of work that we are doing. Earlier on, we were a smaller group of people, and now I can see the level of collaborations that you have and the partnerships that you're building across the nation is amazing work. So thank you for doing that.
Thank you for laying all the groundwork. And this is a perfect segue into what I'd like to ask you now. Now that the organization is growing and you've mentioned some of the professors who kind of put you on the path you are today, we'd love to ask you if you have any words of wisdom or any thoughts as a mentor to prospective SAPHA members and those entering public health and South Asian public health. So we'd love to get some pearls of wisdom from you.
Wow. This is an interesting question. When people start asking you for advice, it tells you that you're the most older person, you're the eldest person in the room. Because my life career track hasn't been a straight line, as you shared earlier. So one thing I learned is to hold my passion really strongly and being persistent about it. If these are the 2 things I think that have been the hallmark of my life's journey in building my career, that I knew I was passionate about social medicine, preventive medicine, and I wanted to engage with communities. I wanted to work hands-on, and in a meaningful way. So a lot of service community work has been done in the United States. There's a very amazing history about work being done, but it has not translated into national level health outcomes information for South Asians. And it's only in the last decade, or maybe in the last 5 years, that people have started talking and really understanding the importance of data deaggregation and understanding how it impacts. And because everything, policy, law, funding, money, follows data and follows information. And so I love I mean, anything that I can think of, that is the most important is being persistent, because it felt very isolating when I started. I was the only South Asian PhD student at University of Michigan. And I was the only South Asian, person in 99 and 2000 who was stepping out from medicine to public health. But then over the years, I've seen so many younger generation students coming in, South Asian students coming from so many different countries in South Asia, and having the interest. But I also see a lot of them moving away into different fields because they get disappointed and they feel isolated. But learning about organizations that can bind us together and create a collective voice, have solidarity, is important. And the only way to achieve it is if we stay persistent. I mean, we can't let go of that. So, if you are passionate about South Asian health, if you are really, really into understanding and supporting communities that are underserved, and also recognizing and putting across and presenting to people that there is diversity within South Asia. It's not a uniform, homogeneous group, So if you are passionate about things like that, if you're passionate about data, if you're passionate about political science, there are so many ways you can connect. It doesn't have to be just research how I do it or health outcomes the way I do it. But in every scope of education and sphere, there's a way to connect and contribute. So being passionate and finding unique, innovative ways and persisting on the track is the way I would advise any young student working on it.
Thank you so much for sharing that. It sounds like even though you were struggling being the only one, you really paved the way for, us to kind of keep that advocacy going on and, have those conversations like you mentioned. So as you reflect on your career, what would you say is the biggest lesson you've learned, or one thing you wish you knew when you started your current public health profession that, folks that are starting this profession may want to keep that in the back of their mind?
Wow. Looking back, I really think, there's a song, and I don't know if everybody knows, all is well. It's very cliched, all is well. But stepping out on innovative paths and doing different things sounds scary. But if you do have the courage, and if you decide on it and you gather courage and you move forward, it's amazing how many mentors will step up and support you. I mean, avenues open when you're ready to take the plunge. So you have to trust yourself and be courageous and walk that path and recognize the importance of mentors. No, when it comes to mentorship, people just assume that mentors have to be maybe their teachers or maybe their senior colleagues, but that's not true. I found mentorship, for example, I met Ranjita Mishra in very early in 2010, 2012. And I heard her talking about at APHA about diabetes intervention program for lifestyle changes for South Asians. And she was doing that study in Texas, and she was collecting data across the nation. And she was funded by, I think, NIH at that time. And just being an audience member, sitting in my PhD program, student, brand new to this country, 10 years down the road. And I'm listening to this amazing professor and thinking, wow, this is something to aspire to. And so I looked and searched all her work and all the things that she had done. So mentorship can be found not just in people. You don't have to have a one-on-one relationship with somebody, but you can be inspired and mentored by the track that they took. And that can give you ideas about, oh, this is how you can approach. I remember when the masala study came out, they were fellow colleagues in terms of being clinical MD professionals, and they were doing work on heart disease. So there were, sparks of amazing work being done for South Asians across the nation. And for me, the place I was, if you, there is so much of learning that you can do from fellow colleagues across the nation. And so stepping out and finding examples and roadmaps from these mentors was a good path for me to plan ahead and recognize, oh, this is how I can build, this is how I can do, this is what I can do. So funding has been my way of learning from these mentors to recognize that if we want to bring attention to South Asian health, then we need to make sure that we are speaking to policymakers and getting funded for work for South Asians.
Thank you for sharing that. That has been incredible, and you've had a very impressive impact on SAPHA and the history of SAPHA and what we're doing now. So your impact is definitely present, but I'd love to hear a little bit more about the personal side of your experience. Were there any moments or just social aspects of being part of SAPHA that you enjoyed the most? Any memorable experiences that just stand out?
My favorite memory of SAPHA is the retreat. I think, we used to have the full day retreats earlier on in 2016, 2017. We used to come early in the morning, a day before APHA began, and we would huddle together and create the whole chai and chat event. But, we are still meeting online and we're having, amazing relationships. But being in that retreat in person and learning about each other and being in different professional fields, interested in public health, interested in South Asian communities, brought a few of us very close to each other. And so it created lifelong friendships. For example, with Yusra, she's a younger colleague. I mean, here I was almost an assistant professor, and here she was starting her PhD track. And to recognize, her commitment and her strength and building those lifelong friendships is one of my favorite memory. The second memory, of course, will always be getting Dr. Murthy into our chai and chat. And and it was my first exposure to organizing such an event. And so he came with all those his whole his whole team, and they walked in, and I really felt that day that whatever we are doing, I have a meaningful connection and impact. We do have our voices matter. For the first time, I felt, otherwise you could do your own research, you could do your job, and you could be happy and you can live your lives but to recognize that our voices have meaning and somebody's paying attention to it. And that was such an amazing feeling that I got as a younger person, And for example, when you guys went to White House, recently, that must have been such an amazing experience for you guys, because we are bringing our voices to people who are important and say that we matter. And that feeling of understanding we matter was a very good feeling as a young person, very good feeling as a young person. So those two are my, friendships, and that feeling is good.
Thank you for sharing that. It sounds like we should have a retreat that's in person for sure. I think it sounds like a fun way to meet our colleagues and also build those friendships, like you said. So as as we've been discussing over the past 25 years, SAPHA has achieved significant milestones in research, advocacy, and national health campaigns, as you mentioned, with impactful engagement in Washington, D.C., and making strong impacts on South Asian health. Looking ahead, where do you think SAPHA can be most impactful in the next 25 years?
Doing different things across my career path in terms of teaching, research, advocacy, writing, publications, funding, I have found most meaning and impact in advocacy. And the reason why is because if we don't have space on national fronts, regional front, local front, then all the work that we do can disappear and will be stuck in journals or in institutions or in educational books. But advocacy is a space that needs growth and constant attention. So it's not, I know that amazing work has been done, in the last, at least for the last 3 years, amazing work at SAPHA. The growth has been a jump. It's a huge jump as to what the organization is doing. I really, really believe that. But if the momentum goes away, so we have to keep at it. So to keep at it, there's one point that I believe that any organization requires, and this is a conversation that I had, earlier on with our president, Memuna, from Chicago, is the importance of sustainability and building infrastructure. So when we joined SAPHA and we were a smaller group, we recognized that the founding members of SAPHA had done such amazing work, and they had established the organization, gone through that big hump. But we hit a point where we were kind of, settling into a little bit of research, a little bit of connections, a little bit of collaboration. But to go to the next level where you are kind of hitting today, needed infrastructure and needed sustainability. And to do that, I know that Samira has been instrumental in working on the, bylaws, on building infrastructure, building handover. I remember, having in a Word document, writing passwords for Facebook and for the website. There was no handover system that had been established. So we had lost a lot of information about SAPHA initial paperwork. So recognizing that we have to keep the organization growing, and how do we do that is by building infrastructure and a policy and bylaws that will keep, future board of directors informed as to how the system goes. So if we have infrastructure, if we are sustainable, the way to grow towards is advocacy, because that is highly required. And the other thing is, there are a lot of community members who don't have voices within the South Asian community. And this is an opportunity for us to be their voice, to bring their stories forward. I remember one of the ideas we were floating about a few years ago was this whole idea of a visual life story of different South Asians in different parts of our country. Wherever we were, we could connect with them, get their stories, from our grandparents and aunts and uncles. And, histories and stories are getting lost as to how they came in 1960s and they were working in a shop and then they did this, and how they progressed in their life and made lives possible for their kids and grandkids. So those stories can be documented and presented, so there are multiple ways to give voices. And I'm sure you guys will have much more interesting and smarter ideas than me when it comes to highlighting these voices. So if we can be an organization that people look up to and say, we can go to SAPHA and ask for help, or we can connect, they will show us, there'll be some way of learning from them. As on the other side of the spectrum, as a professional, I check on SAPHA and just to see what is the latest health fact, what is the latest information, what is the latest, event happening. That is what is exciting for me to know. So I think that is the pathway for growth.
Thank you so very much, because this leads right into our next question. And I'd love to pick your brain on your subject matter expertise as a clinical researcher. I want to ask you, where do you think the future of public health should be headed? And then we'll talk a little bit about your experience and your expertise with technology-related healthcare.
So as a clinical researcher, I mostly have functioned in the realm of training providers and physicians on how to address the needs of vulnerable population group. And the idea is that when you're thinking about health utilization, it's not enough to say that South Asians don't utilize healthcare systems. We are lagging behind in utilizing healthcare systems, especially for mental health services. It's not enough to say that we need to think and understand the barriers that South Asians feel or experience, but it's also important to make sure that our providers are trained to address the needs of South Asian health. The burden of change or the burden of knowledge or the burden of learning doesn't only lie on the community. It also lies on the people who are providing the services. So as far as my clinical research work is in the last 5 years, has been concentrated on maternal child health among vulnerable population group. And we try to address challenges. We listen from the community, we understand and collect data from them, and we translate it into training modules. I've been a part of grant funding for the last 7 years about how do we develop using VR technology, how do we develop training modules for providers? And that is being implemented and used in the state of Ohio in medical schools. So the idea is, suppose if you meet an Asian American who is experiencing dementia, who lives in a multiracial household. So he's the grandparent in that household. How do you communicate? How do you understand? How do you cross cultural barriers without hurting or blaming any family member? So how do you address those situations? And how do you as a provider address family sessions, and cultural barriers when you're negotiating and talking about shared clinical decision making for families? So those are the kinds of things that I do in my clinical research. And remind me, what was the second part of your question?
You're doing great. The second part of the question was, how do we use everything you're doing and everything that's being done in public health right now to advance and improve healthcare? So I'm going to bridge it a little bit back to your work with virtual reality. So you're bringing in virtual reality to address how do we not blame anyone when we're providing care? But from what I've seen of the South Asian community, and please let me know if you've seen something differently, is that I come from a background where my parents barely went to high school. So they're not very fluent in English, and they're definitely not tech savvy. So their digital literacy is pretty non-existent. Whereas there's this whole group of South Asians who come to the US for education purposes, and they're very well educated. So South Asians are on the spectrum. How do we use technology and your work in VR tech to bring care to these groups? It's a great question, and we don't have to answer it today, but
No, that's fine. This is something that we've been funded recently last year. We received funding from the Ohio Health Department is to understand the importance of telehealth. And so just to give a quick background, we had submitted a grant funding to understand and build a telehealth intervention program for vulnerable population groups, exactly with the challenges that you are sharing. It was in the realm of maternal child health. So, when there is a pregnancy event in the family, that experience is at least for 2 to 3 years. What I mean by that is the time span for pregnancy and then having a child until the child is 18 months old. That is the cutoff that you get funding from the government through WIC and other things. So exactly how you said, how do we address challenges that they are facing? And so we were very excited about this project and about this intervention. And then COVID happened. And then everything shifted to telehealth within a second. And the whole world collapsed for vulnerable population group because they didn't have the opportunity and time to switch and learn. So there was no time to, like a transition phase where we could do trainings and things like that. So recently we've been working on this idea that we need to develop and inform how do we use televisits, telemedicine, and telehealth to the max. And right now, the way the hospital systems functions, at least in my experience where I am, is you get a sheet of paper which tells you this is your password, this is how you join, and pretty much everything is in English. There is one of the systems that has been developed for in Spanish, I believe, but it hasn't been implemented nationally. So language is a huge barrier. Besides language, the recognition of all the tabs and the services it provides. Number 3, suppose if you're smart enough to go on that website, you open up your tabs, you see your labs, and you see those flashing red flags. And you have not processed and you don't have the knowledge and information to process that information because you don't have your doctor's visit till, say, 10 days after it. So how do you process information that is being given to you? And you see all these red flags on the portal, and how do you deal with that? What should the health system do about that? So we are still grappling with these questions. We recognize these are important issues. And I know that there are multiple interventions being tested in multiple health systems now to make sure how do we address it. It doesn't solve the problem, but there is an interesting program that is being done right now. It's called the Centering Plan, which, it's another research group that is doing it in my institution. And what they've done is they've collected a panel of 5 to 6 providers that include social worker, nurse, physicians, other expertise on the table, and they connect with the patient together and have a group discussion like how we're having right now to address their needs in one place at one time. So it's not like your follow-up is 3 weeks down the road here and 2 weeks down the road there. So I think we are in a place of transition and movement in the healthcare system. There's a huge recognition in the healthcare system that we need to address social determinants of health. We have to think from the angle of health equity and social justice. We have to make sure that we address the needs of the community. Because if we don't address the community that we serve, as far as the healthcare system is concerned, we will be overwhelmed. And they understand the value of money and how much money will be spent in addressing the burden of the cost of people being more sick. So we are still in the phase of transition to figuring out what we should do. It doesn't solve the problem for people right now, but that is the path that is going towards, in terms of more knowledge, more training, and also recognize that when you meet a provider is somebody who could be doing who did his med school in India and came to the United States right now. So they are not even aware of the cultural norms and the challenges that the community faces in the United States. So there's a lot of layers of training that even providers need to know about who are they serving and what are their needs. So it's on both sides, that education knowledge, and there's a lot of digital funding that is happening through the government right now to support, access to the internet, subsidized cost, for internet services, cell phone services to the community. But I don't know how much awareness there exists in the community about these funded, free, subsidized programs. So there's still a disconnect. We are not a smooth flowing system right still yet. So there has to be some kind of a care coordination happening. But I'm sure we are walking towards it. We are walking towards it. Yeah.
Yeah, thank you so much for, highlighting the disconnect that exists in the field when it comes to provider and patient interactions. You mentioned, telehealth and some of the ways that it can be helpful, but also it does bring some challenges, especially to, like you mentioned, vulnerable populations. So just moving on, you talked about sustainability. It is definitely a critical factor in the success of any public health initiative. In your view, what are the key factors that ensure health equity initiatives for South Asian communities remain sustainable? And how can these initiatives continue to impact these communities along after the initial funding has ended?
I've been on a health journey for myself, and one of the very important things the health coach asked me right at the beginning is why? What's your why? So, that is identical to what your mission and vision is for an organization, for an initiative. And if we have our why in the right place, then every step that organization takes stems from that vision and mission. So we keep that at the forefront. And as far as I know, SAPHA has always included health equity in its mission and vision, to address the health needs of South Asians. So that is keeping our why strong and clear at the forefront for everything is step one. Now, the second part of the question is, suppose if the initiative is done in 3 years, 5 years, once the funding is finished, what do we do after that? Like, does it die? Does a program die? What do we do? So one of the things that we talk about in our community work in public health is train the trainer, or work with community health workers, or engage. So the principle of CBPR, community-based participatory research, that we use in research can also be implemented through program planning and intervention. The idea that it is generated from the community, with the community, and given back to the community. So if we associate and collaborate with community members right from get-go at any initiative, then it is easier. I'm not saying it is 100% possible and it's a guarantee, but it just makes it more feasible and possible that the program or the interventions from the program can be sustainable. Because if we can have paired partnership, or ownership of the project between the community and the organization or the people who are running the initiatives, that is the only way I can see it going forward. Otherwise, it is always difficult for anything to continue. Sustainability has to be a forefront picture that people have to be thinking. As we talk in our grant circles is, so the first thing is you get the funding, and the second thing is once you leave with so much infrastructure in place so that the people or the community or the organization can survive without our being present there. So that would be an ideal situation for it to happen. But this is a very difficult process. If it was this easily done, then I would have said, yeah, this is the only way to do it. I'm sure there are multiple ways of figuring it out, but having your why in the right place and thinking about sustainability right from get-go with the attention. And the only way is that when people who are in institutions or in the hierarchy of relationships, when we walk into communities, we engage with complete humility and understanding that the community owns and understands themselves better than what we do. And that's the only way to move forward.
That was very informative. Thank you very much for that. There's just a lot packed in. But I want to continue talking a little bit more about your expertise and your experience as a researcher and kind of take advantage of that, because as an early stage investigator and as someone who's interested in health equity, specifically with South Asian Americans, I was wondering if you had any experience, any thoughts for me, other early stage investigators and SAPHA as still a relatively new organization, if you have any thoughts on how emerging researchers who are focusing on South Asian health equity can help improve their grant proposals. How can we improve our grants to secure funding in public health research, especially when there's so many other incredible projects going on and funding is very, very limited?
Yes, let's start with the fact that the funding is very limited. And with full recognition that, it ranges between 5 to 10% success rate for in the field in the public health. So it is challenging, but it's not impossible. Some practical advice, which I have found, there are certain tips that I found really useful in being successful. One of them is a scouring reporter, NIH reporter, reading through interventions that are being done across the nation. So one of the challenges that I think that early investigators face is, we have to write a section in our funding about innovation and significance. And everybody assumes that we have to like find the moon or find the next planet, and that's the only way we'll get funded, which is not exactly, I mean, that would be amazing, but in public health, that's not how it usually works. If you can find a role model, a success model of an intervention or a research plan that has been successful in another part of the region, in another population. And so you can build ideas from what has succeeded in multiple places, then put it together and see what works for your population, or your target population. So learning from others, is important. You can't duplicate what they did, because not because it's wrong or anything, it's just because it won't apply to the patient population or to the community population that you're serving. But recognizing the importance that this intervention has succeeded, and that should be quoted in your proposal, that this different aspects of this proposal or this design or this intervention has succeeded in different populations, different age group, different diseases. So we want to test it and see it if it is possible in our population group. So that is one practical way of thinking about it. So I actively look and search and review what other people are doing and learn from them. And I have never hesitated in contacting successful researchers. I have written blind emails to them and sharing my interest and my gratitude for inspiring me. And if I can connect with them, if I can learn what made their proposal successful. I have never hesitated in asking anybody. And believe me, you would think that we professors don't like to respond. I can guarantee 1 in 3 people will write back to you. People generally, genuinely love the fact that somebody read their work, somebody learned from it, and they're ready to take it forward. That's the whole point of academic work, and research work. We take each other's work forward. So that is something that I would do. I would connect, and sometimes you make these lifelong relationships that you can collaborate for many other things. So that's number 2. Another thing, what makes grant proposals successful? Oh, yes. The third thing is the biggest challenge I think new investigators have is on their approach. And the approach is actually the research methodology and the approach and the data that you are usually writing about in your research or program planning or interventions has to be very appropriate. And so my suggestion is that when you write a proposal, let other people read it. And because when you think about it from the reviewer's perspective, you have this NIH roundtable and you have to read these 10 proposals and then you have to make comments and then you have to say, okay, these 5 will be discussed. So when you're making those levels of decision, there should be clarity. And I remember very early on when I had written to the NIH for the first time, I had a pulmonary specialist read my proposal, a clinical specialist. She looked at it, at all the pages. There were, 10 single-space pages. And she said, You just have 2 tables. This proposal is too dry. It's not attracting my attention because I have to read so many. So don't be just word-based, be visual in your writing. And that is something that has really struck with me that I had never thought about, had never trained, thinking about that you should be more visual with charts, so that you guide the reviewer to understand your proposal. So, even if those charts or smart images or pictures are simplistic, but it helps a reviewer understand your proposal deeply and better, so that they hopefully, fingers crossed, they don't find too many faults with it. So those are my practical tips for it. I hope that helps. If nothing else, I'm ready to read your proposal and give you advice.
Thank you so very much. That actually is very helpful. And I love the feedback of having other people review your proposal, because I've been told many times that it's too ambitious. You can't do all of this, and that helps as well. So this is very helpful. I appreciate it. Thank you.
To your earlier point, mentorship can look very different and come in various different ways. So thank you for sharing that. And this has been such a great conversation. We've learned so much from you. We're coming to the end of the podcast. So as we wrap up, we have one last question. What's one key action you believe our listeners can take, whether they're just starting out or they're well established in their career, to advance South Asian public health in a meaningful way?
I think collaboration. Just because, do not assume your identity just to be a singular identity. Your identity is multiple. For example, I'm a woman, I'm a professor, I'm South Asian, I love to sing, I'm a bad singer. All these identities gives you an opportunity to collaborate in multiple spaces. So don't silo yourself into thinking, I am this kind of researcher, or I work only with chronic diseases and diabetes. Don't silo yourself, because there is so much innovation in interdisciplinary work that is amazing. I'll give you an example. One of my colleagues was working with young adults, school kids, and they were trying to build an after-school program to keep them safe in the area of Flint, which is in a very underserved neighborhood in a community. So how to keep those kids safe. And they built a hip hop class, a dance class. And they invited, graduate students from the School of Dance, from the university. And so they held sessions and engaged the students. So collaborations can help you think outside the box. And thinking outside the box is how you get funded. And innovation and ideas and inspiration happens when you talk to different kinds of people working and thinking in different ways. So I have a set way of thinking, and that is because of my training and expertise. But when you meet people from different disciplines of different, experiences, when I'm working in, right now I'm writing a grant with the School of Engineering, and they have a completely different way of communicating. Sometimes I feel like I'm speaking a different language and they're speaking a different language. But there's so much amazing stuff that you can build across disciplines, across expertise. So step out and network and collaborate with people from different disciplines. That is true for people who are starting, and that is true for people like me who are mid-career. For anybody, keep challenging yourself with meeting different people and getting inspired by different people.
Dr. Singh, thank you so very much for your time today and for taking us on this incredible journey through your experiences and for providing your insights. It's been an absolute honor to have you as a guest on the South Asian Public Health Association's Spotlight Series. And to our listeners, I want to thank you for joining us on this milestone episode. Please stay tuned for more conversations with past SAPHA board members as we continue to explore the career progress of individuals who paved the way for change within the world of South Asian public health. Follow us on YouTube and Spotify by subscribing to our channel. And if you enjoyed this episode, please consider donating to SAPHA at www.sapha.org. Until next time, this is Sloan and Rubana signing off. Thank you.